My name is Peter Bash. I'm a primary care doctor and Senior Director for Health IT Quality and Safety for MedStar Health. E-prescribing, as we all know, has lots of advantages. I think the first few things I noticed was the process of writing a prescription can initially be longer when it's done thoughtfully and legibly into an EHR or e-prescribing application. However, once it's in, it is used several times. So for example, when I'm creating a medication list, I write a prescription. If I want to be on the med list, it's also on the med list. This made it easy to essentially reuse for a third time what was initially just an e-prescription in giving the patient information. And lastly, it allows for very easy med renewal. Other benefits aside from legibility include the potential for drug allergy, drug condition checking, and of course, certainly it makes it, I think, easier in the fast-paced world of being a clinician to do the right thing. In our electronic health record, we have not yet implemented and used CancelRx, but I'm very familiar with what it can do. Clear example with patient safety. It is very common in the workflow of doctors such as myself, a primary care doctor, to adjust medication dosage or change from one drug to another in control of a chronic illness, let's say hypertension or diabetes. And it's very confusing to patients, particularly those on multiple medications, to say, all right, remember you are on one of your 3 blood pressure pills. I want you to stop that one, and I'm going to give you a new one to take in its place, which is going to look similar to the name, but it's going to be a different milligram, and that one's only once a day. All right, I've already forgotten what I've just told the patient. Imagine the poor patient trying to remember that. We end up in this unfortunate situation of having a misunderstanding because there was no clear communication to the pharmacist. What I have prescribed before, cancel it. Get rid of it. Do not allow that empty bottle to unintentionally create a medication error, either by duplication or substitution. So I think there's tremendous utility there. SureScripts has a great advantage in that it is, as I see it anyway, a neutral, secure network. And I think the rules of the road that go along with SureScripts, meaning when you enter that information, we're not going to change it. We're not going to redirect it to a pharmacy that's advertising, because there is no advertising allowed. And we are, in essence, supporting the doctor-patient decision-making, because so many people use SureScripts for prescribing and prescribing information. It's kind of become a great example of a real business case for health information exchange, and one that's done that actually always serves a valuable purpose.